Hello all, my name is Josh, and thank you guys for coming today to our cataract surgery webinar. We have with us Dr. Jake McMillin here. He's going to be going through just some pointers on cataract surgery, what to expect, what's involved, and what choices you guys have in terms of your post-operative outcomes and results of the procedure itself. A couple housekeeping notes here. On the right-hand side of your screen, you should see the go-to webinar menu there. About 2/3 of the way down, you'll see a tab that has questions. If you guys have questions at any point in time as we're going through this presentation here, please go ahead and just chat those questions. And at the end of the presentation, I'm going to go ahead and read those to Dr. McMillin here so he can get all of those answered for you. We'll have plenty of time for that. So just put those notes in there and we'll catch those at the end. Other than that, we hope you enjoy what we're going to present here, and we'll review your questions at the end of the presentation. Over to you, sir.
All right, great, thanks. So thanks for joining here. It's Wednesday afternoon. We're just going to take a few minutes. This is a service to you guys, to our patients, to try to give you the best information you can about a common condition that we see in clinic, and I'm sure something that comes up with you and when we're talking about these sorts of issues. So hopefully this is helpful. Please feel free to ask questions. Make sure that we answer the things that you want to know. All right, so I am Jake McMillin. I am an ophthalmologist and surgeon here at Campbell, Cunningham, Taylor, and Haun, where I perform cataract surgery, laser vision correction, corneal surgeries such as cornea transplants, and take care of a whole host of eye problems. And cataracts and cataract surgery being one of the most common ones. So this is a kind of a funny picture. I was a surgery intern in Colorado after medical school, my first year out of medical school, and this was one of my favorite runs at Beaver Creek Resort. And so it's kind of serendipitous that I ended up being a cataract surgeon. But you know, cataract is an interesting word. The word cataract actually means, in Greek, cataractus sort of means multiple areas of flowing water. So you see the picture on the right. This is kind of a beautiful waterfall scene. And if you look at the picture on the left, that's a really mature cataract. And what you can see, and what the Greeks saw, is that there's sort of these multiple areas of varying shades of blue and white that sort of look like this waterfall appearance. So I've always thought that was a pretty neat word origin for the disease. So what exactly is a cataract? A cataract is the clouding of the natural lens inside the eye, and this is a totally normal condition. All of us that are lucky enough to live long enough will develop a cataract. And I use the analogy of a peanut M&M with my patients. You can see this peanut M&M here at the bottom of the screen. And so the anatomy of the lens is very similar. You've got the lens capsule, which is like the crunchy outer shell, the cortex, which is like the soft chocolate, and in the middle is the hard part. That's the nucleus. And most people with cataracts develop a nuclear cataract. So the center, the hard peanut, turns yellow and becomes opaque, and you can't see through it. And that's a typical age-related cataract. Now you can have clouding of any portion of that peanut M&M. The cortex, the chocolate, can become cloudy, or the capsule. So, but most people get a big, hard yellow center, and that's the cataract they develop with age. So why do we get cataracts? There are a whole host of risk factors, things like sun exposure, patients who have been very ill in the hospital, ICU type stays, diabetes, people poorly controlled diabetes, or even well-controlled diabetics tend to get cataracts earlier, and just a general poor overall health, trauma to the eye. I've certainly seen people that have had multiple eye surgeries, especially retina surgery, and the most common one is just having a whole bunch of birthdays. People will tell me with their cataracts that they get cloudy or blurry vision. That's certainly the most common thing that I hear. Glare and halos are probably the second most common thing, and that's typically at nighttime with glare around headlights. The LED lights are really bright, and for folks with cataracts, they are really difficult to see the road. Patients will tell me that especially dark country roads, they lose the lines in the roads, and those tend to get washed out. The colors are different, and then oftentimes when you're getting close to needing cataract surgery, the glasses seem to keep changing, and it doesn't really make a huge difference in the quality of your vision. This picture on the bottom left is a picture that I took actually through my microscope in the clinic. And this is the reflection off of a patient's cataract that was coming back at me in the microscope. And so I know that if I'm getting this reflection off the patient's cataract, this is essentially what they're seeing. And so you can see those sort of starbursts, the rainbow effect, and all that glare. You know, when this patient drives at night, she certainly is having a hard time seeing the road. This sort of yellowed out image is a representation of sort of the loss of contrast that patients will see, especially once they've had one eye operated on. They have a really stark contrast between the colors in the two different eyes. This is a really interesting photograph here, or image here. So Monet, the famous painter, in his painting of the bridge over the water lilies, this picture on the left is from 1899. He developed a really severe cataract as he got older, and this is the same setting and his same painting 22 years later, or 23 years later, 1922, and he had developed a pretty severe cataract. And so you can sort of get the idea through Monet's eyes of what a really mature cataract did to his vision. And I think that's a really neat historical context for cataract. Patients will often ask, how does this cataract really affect my vision? So the analogy I use is a camera, and the eye is just a living, breathing camera. Just like a camera here on the left, the light enters the eye, it goes through the lens, and the lens focuses the light onto the film. Well, the eye is not a whole lot different. The light enters the eye, it goes through the lens here behind the colored part of the eye, which is the part that turns into cataract, and it's focused onto the retina. So anything that impedes the pathway of light to the retina is going to cause decreased vision. When this turns yellow, opaque, gets cracks and things through it, that's the cataract. The light gets scattered and is no longer focused well onto the retina. So when we replace the cataract with an intraocular lens, we were able to remedy the most common reason for decreased vision in folks. So most people do get cataracts. If you're 80 years old, more than half of your peers have cataracts, and many of them have had cataract surgery. It's the leading cause of vision loss in patients over 55, and worldwide, it's the leading cause of reversible blindness. We're lucky in the US that we can treat cataract relatively easy and have easy access to it, but that's not the case in other parts of the world. It can occur very slowly, and you may not even realize that you have cataracts until you get an eye exam, and the vision is very poor at the exam. It's not a medical emergency. You can live with cataracts. It's not going to turn into a tumor or cancer, and it's not going to necessarily hurt you in most instances. However, the secondary effects are certainly worth considering. Patients will start to feel uncomfortable driving. You certainly have an increased risk of having car crashes, falls, anything that can occur with decreased vision. So we certainly like to treat folks with cataracts so they don't have an increased risk for falling and having car crashes and things like that. It's one of the most commonly performed surgeries in the world. Over 3 million cases are performed annually, and that's just in the US. And the success rate is exceptional. And our team has performed thousands on a yearly basis. So if you've been diagnosed with cataracts, what happens now? I think the first thing to consider is just, take a deep breath, realize that there's been years and years of refinements and fine-tuning of cataract surgery, and we have a really great team at our center to take care of you. We have 5 cataract surgeons, and we're sort of a one-stop shop for your cataract problems. Our diagnostic equipment, our surgical center is all under one roof, and it allows us to really have a really intentional control of the quality of care that we can deliver within our center. Our surgery center just celebrated their 25th year in practice, and believe it or not, many of our technicians have been here the entire 25 years, and I think that just speaks to the consistency of what a great place it is to work, but not only the consistency of outcomes and the care we take care of our patients, that our staff really enjoys this. So what can you expect? Typically with cataract surgery, we do one eye at a time. It's a day surgery. You come to the surgery center for 3 to 5 hours from start to finish. The actual surgery is not exceedingly long, 15 to 25 minutes. You need someone to drive you there and drive you home because you're going to have some sedating medication that's going to make it unsafe to drive. Plus, your vision, is certainly going to be blurry right after surgery. Insurance does cover cataract surgery, but there are oftentimes copays depending on your insurance plans. There are lens upgrades that can add out-of-pocket costs, and we'll discuss why someone might want to do that. Use eye drops for a month, and then the post-operative clinic visits are 1 day, 1 week, and 1. As far as post-operative care, we use 1 bottle of drops. This is a strategy that we have recently adopted. We have all 3 medicines compounded into 1 bottle. This medication is available in our office through our optical shop, and you use that 1 bottle of medicine for about 4 weeks. In the past, we've had, instead of having the compounded drops, we had 3 different medicines you had to pick up from your pharmacy and use 3 bottles for a month. And so we've greatly simplified that for our patients. It's normal to have tearing and gritty sensation for a few days after surgery, and we have you sleep with the plastic eye shield like the picture shows here for about a week. And we ask you generally to take it easy with no heavy lifting or putting your eye underwater, such as a swimming pool, for during that time. So how is cataract surgery done? We give you some IV sedation, a little bit of local anesthetic, make you sleepy, but not all the way to sleep typically. Some folks will fall asleep during surgery, but you're breathing on your own, and you can move your eye for us when we ask, but you're very comfortable and generally relaxed from the IV medication you've received. We break down the cataract using ultrasound energy. So we use high frequency sound to break up the cataract into many small pieces, and then it's removed very gently through a very small tube. So the cataract kind of comes out in small pieces. It doesn't come out all in one piece. We put an implanted lens in the eye called an IOL, and this is placed into the eye, and this is very specific to your eye. We choose the lens that is needed for your eye, which is different for every patient. So this is sort of a custom chosen lens for you. You can see a picture of that lens on the tip of someone's finger here. They're acrylic and they're foldable. We were able to put them into the eye through very small incisions and then unfold them in the eye. Typically, there's no stitches required. Occasionally, we will place a suture in rare cases, but it's typically not necessary. So there's an important question about how we go about cataract surgery. And one important conversation we have with all of our patients is, what are your goals with surgery? The most typical way to perform cataract surgery would be path number 1, that is standard cataract surgery. And the goal of standard cataract surgery is simply, let's get the cataract out, make your vision better, but afterwards you're going to need glasses for most tasks. You're going to see great, but you're going to need glasses for most things. So most commonly, folks will go into a bifocal because that helps with their distance and their near vision. There are some patients who, after cataract surgery, standard cataract surgery, if they have very little glasses prescription, they may find that they can see well at distance without glasses, but then they need reading glasses for all things up close. Insurance covers this. Your only expense is typically your copays for medications or for any surgical copays or deductibles that you may have. Now, the second path for cataract surgery is what we term refractive cataract surgery. And there are 2 goals of the refractive cataract surgery. The first goal is the same: remove the cataract and improve the vision. The second goal is to do this same task, but to significantly reduce the need for glasses for some or most tasks. Insurance covers the surgery. However, to achieve that goal of reducing the need for glasses, there can be some out-of-pocket costs associated with that. And those out-of-pocket costs cover things such as an upgraded lens implant that your insurance won't cover, or additional technologies that we need to help you accomplish the goal that you want and the outcome that you want with your vision. Standard cataract surgery uses what we call a monofocal IOL. That is a single focus lens. And in general, we focus that lens for your eye at distance. Most people will need some degree of glasses for reading. Well, all patients will need glasses for reading, and most patients will need some degree of glasses even for distance. Now, You may be happy with the quality of the vision at distance, but glasses will almost always make it more clear. When we talk about refractive cataract surgery, we have this whole toolbox of options, and it really depends on your eye, how your eye measures, and the specific characteristics of your eye as to how we can approach your surgery to reduce your need for glasses. Some of the technologies that we use are things such as trifocal IOLs or multifocal IOLs. These are lenses that work similar to trifocal or bifocal glasses. They have multiple zones within the lens that focus light to multiple spots. So typically the lens will focus light at distance, computer, and near. And you can see this lens in the bottom left-hand corner of your screen with those rings there. Those rings are the technology that is making multiple focus points in that lens. For our patients that are really want to get out of glasses for most tasks, these lenses work well, and it's an important thing that you can discuss with your surgeon as to whether you're a good candidate for those lenses. The second type of lens, and one of my personal favorites, are toric IOLs. Toric simply means astigmatism. And there's a toric lens over here on the right side, and these little dots indicate that it has astigmatism correction. For my patients that wear astigmatism correction in their glasses, these lenses can significantly reduce or eliminate their need for distance glasses. Now, typically they will still need reading glasses for most things. However, I find in my patients that have a lot of astigmatism, they are so incredibly thrilled to reduce that astigmatism and have crisp vision at distance. I really encourage patients to consider astigmatism correction for that reason, because I'm just always overwhelmed with how happy these people tend to be. Now, the third technology that we often utilize is called Opti Plus. And this is a strategy of reducing mild amounts of astigmatism by doing some relaxing incisions in the cornea. These are for patients who don't have enough astigmatism to need a special astigmatism correcting lens, but they still have astigmatism in their vision. We use a device called the ARE, which I'll discuss in a minute, which is a laser measuring device during the surgery to help find the perfect implant for your eye. Patients that end up using the Opti Plus strategy will often need glasses for reading, but we can usually minimize glasses for distance. So this is just another strategy your surgeon may recommend depending on your eye. The ARE technology is a technology that we use for all of our patients who are desiring to reduce their dependency on glasses. It's sort of a revolutionary technology in that during the cataract surgery, after we remove your cataract, we use a laser measuring device to measure the eye and the astigmatism, and to decide at that time what power lens or astigmatism correction you need. You can see in the bottom right corner, this is a screenshot from the surgical microscope, and we often kind of joke it's sort of like Top Gun for an eye surgeon, in that you have all this live data that's streaming into the microscope, and that's giving us a lot of really great information during your surgery. And we have a whole array of catalog of lenses available to us, and we can choose exactly what we need at that time for your eye based on your measurements during surgery. So this has been an incredibly helpful technology during eye surgery. So I hope that was helpful. There's a lot of information there in that presentation about surgery, and it's really important if your goal is to try to reduce your dependency on glasses. It's very patient specific, and there are questions you want to discuss with your surgeon, because one size doesn't fit all. Well, the right answer isn't the same for every patient, and it takes the right combination of technology with the right patient to achieve the outcome you want. I'm going to go through a few questions that I commonly get and probably answer a lot of the questions you may have. The first is cataract surgery safe? It's a question we get all the time, and anytime you do surgery, there's certainly a risk-benefit discussion. In general, cataract surgery is very safe, and our patients do extraordinarily well. Any surgery involves some degree of risk. Things like infection or need for secondary surgeries are possible. However, when we talk about risk of infection, we talk about risk of 1 in thousands. The rate is so incredibly low. However, anytime you have surgery, there's always a risk of infection or a risk of unforeseen things that can occur. However, the rate is so low that we feel very comfortable moving forward with surgery for most patients. Does cataract surgery hurt? Now, this is a great question. Cataract surgery, surprisingly, is I wouldn't say it's painless, but it is very minimal discomfort. Patients tell me that during the procedure, they feel a little numbing medicine at the beginning, the stinging from the numbing. They feel pressure and cool fluid. Afterwards, my patients will describe a little scratchiness and itchiness for a couple days. They may take a Tylenol the night of surgery, but in general, of all the surgeries I do, cataract surgery seems to be one of the best tolerated. And I try to really reassure my patients, if they're worried about pain, that this is not typically a painful procedure. So after surgery, someone has to drive you home to rest. We usually advise that you have someone to drive you the next day. Even though the next day some patients do feel comfortable driving, we just ask that you have somebody there to drive you just in case. You wear a protective shield while you're sleeping. You're going to use eye drops for a month, and we ask you to take it easy for a couple weeks. Stay away from dusty, dirty environments like working in the wood shop or landscaping or any of that sort of thing. We just don't want to get anything in the eye that could cause additional irritation or risk of infection. No swimming or getting your head underwater for 2 weeks. You can shower and let the water run over your face. That's just fine, but we just don't want your eye underwater. Insurance will cover cataract surgery. It covers standard cataract surgery with a single focus lens, except for your copays or deductibles. If you decide to try to upgrade your vision in terms of an upgraded lens or some sort of technology that's going to help you reduce your need for glasses, there are out-of-pocket costs that your insurance does not cover. And this is universal. There is no insurance out there that covers any additional costs to upgrade the lens that we use for you. There is some financing options that you can discuss with the folks that schedule your surgery. When you come for a cataract evaluation, your eyes are going to be dilated, and we're going to do multiple tests. We're going to measure your eyes many different ways. You'll be in the office 1 to 2 hours, and we'll have a detailed discussion with you about what your goals are for surgery, and we'll do our best to try to match your surgery with your goals and tell you, sort of what's realistic and what we can do for you. In some instances, patients will come for a cataract evaluation, and we may recommend that you don't have surgery. And so that's an important part of the evaluation, is determining whether you actually need surgery. And if you don't need surgery, that's great. We will certainly recommend that you wait. But that will be a good discussion to have with your surgeon. So that's all I have this afternoon. If you have additional questions, please feel free to type those in, let us know, and I'd be happy to answer those for you.
Well, thank you, sir. And just like Dr. McMillin said, there on the right-hand side, you'll see that question tab. Feel free to put any questions in there. We're hanging out here for a couple of minutes, and we'll be able to talk through those. Looks like one question I have here, Dr. McMillin. When a cataract patient comes in, goes through the evaluation, and is planning on surgery, when do they need to make the decision on what lens they're going to have implanted in their eye during the procedure? When does that decision need to be made by?
It's a good question. So oftentimes patients sort of have an idea of what they want when they come for surgery, and we can certainly make the decision at the time of the consultation. However, I encourage any patient that is unsure about what they want to take some time to think about it. They can certainly, we can guide them in doing some research, provide them with materials and things. And we typically need to know 1 week before their surgery what they've decided to do in terms of, lens implants and those sorts of things. I would say most patients are able to decide during the consultation with me, but I don't ever rush a patient. It's an important decision. And so just, we just ask patients, they let us know at least 1 week before surgery what they've decided to do.
Excellent. And then, I think you touched on it there. as well, but just on that recovery time, from, the surgery there, are we doing one eye or both eyes at the same time? And then how long until that patient, really from start to surgery on that eye through the end of the process to where they're back visually, feeling, the full effects of the procedure?
Many patients are feeling like they're seeing better the day after surgery. However, I usually tell patients that at 1 week, most patients are feeling, really pretty much back to normal. The first week there can be a little bit of scratchy itchiness, but within a week's time, most patients are feeling very good. When it comes to work, patients will usually take the day of surgery off and the day after, and they usually go back to work the third day. If there's any lifting or things like that at work, we'll put them on a kind of lightweight restriction for the first week. We do one eye at a time, and that is a safety, kind of a safety thing. We want to make sure that the first eye is doing well, that there's no infection, that there's no surprises, nothing unusual has happened with the first eye after surgery. If 1 week after surgery the first eye is doing great, which is almost always the case, we will go ahead and schedule the second eye 1 week out. And so usually we'll do the eyes a couple weeks apart, and that just provides us a little time buffer and keeps patients safe.
Great. And another question here: if patients or folks here on the call are currently working with a local eye doctor who may have, said, hey, you're starting to get cataracts, you're starting to get into this. Do you guys work with those, their current eye care provider, eye doctor, to, make that process a little bit easier for them, in going from that eye care doctor to coming to you guys for cataracts and moving back and forth, et cetera?
Good question. We cover a relatively large geographic area here in the greater Knoxville area, and a lot of our patients do travel from outlying areas, and they may have a pre-existing relationship with an optometrist or another eye care provider that doesn't do surgery. In general, we work with a lot of optometrists and things to do what we call co-management. That's where we provide the surgical care for the patient in Knoxville. But the patient is able to stay close to home and see their optometrist that they know, that they're comfortable with, for their post-operative care. And we encourage that for patients that need that, especially if the travel back and forth is tough. If we don't currently work with your optometrist, certainly we can establish an agreement with them to take care of you. So when it comes time for cataract surgery, if you would like us to be involved with your care, you can request that your optometrist refers you to our office for an evaluation, and then we will take it from there. We'll arrange all the post-operative care, and as long as the optometrist is comfortable and competent in taking care of post-operative surgical patients, which almost all of them are, we will arrange that and make that as convenient for you as possible.
Great. And I think the last question that we have here would be, for the folks that are listening here with us, if, they're seeing their vision, kind of deteriorate, they're seeing that yellow haze and some of those night vision issues that you were referring to, what's the next step for them, if they want to come in and learn more and see, get a diagnosis that they may have cataract surgery, what are their next steps?
The easiest thing to do is just to call our office, the main office number, and make an appointment to see us. It doesn't have to be, you can tell the scheduling staff that you think you may have a cataract if you've been diagnosed with that, or you can just, make an appointment for a medical exam, and we can do a complete exam and evaluate your eye for not only cataract, but the entire health of your eye, looking to see if you need new glasses, or if there's any signs of other eye diseases like macular degeneration or glaucoma. We'll be able to tell you a lot just from a thorough eye exam. And if cataract surgery is what you need, it's certainly something we can offer. However, we can take care of just about any issue that you have with your eyes if it's not related to cataract.
Excellent. Well, I think that does it. Just a note from a person on here, no questions, just wanted to say this was extremely informative, so just a nice little compliment to pass on. Dr. McMillin, thank you for your time. For everybody that attended today, thank you for jumping on with us. and just listening in here, you guys will actually receive an email here probably tomorrow that'll actually have a link to this recording. We found that sometimes it's helpful when you're talking with family or people that are caregivers in your life that may not understand the concept of cataracts in terms of what's actually happening to your eyes. So we'll actually have this uploaded onto YouTube, and we'll be sending it to you in an email, so that if you do have people in your life that you kind of want to give a little bit of an explanation of what you're going through, or just kind of have a refresher course as you get closer to looking at cataract surgery, you'll have this as a video that's accessible to you, and we'll also include in that email, obviously phone numbers and what you can do for a next step if you do want to come in and get that evaluation and see if you may be in that cataract surgery phase with your eyes. So other than that, thank you everybody for attending. Thank you, Dr. McMillin, for spending time with us and taking time out of your day. We look forward to meeting you guys, and have a great rest of your Wednesday. Take care.
Thanks, Josh. Just want to say thanks, guys, for listening. We're passionate about what we do, and it's an honor to serve our patients here in Knoxville. So please give us a call if you need us. Thanks.